Can I get upper and lower eyelid surgery done at the same time?
Cosmetic upper and lower eyelid surgery, or blepharoplasty, is a very popular procedure throughout the world. The goal of these procedures is to improve the aesthetics of the eyes by addressing excess and sagging upper eyelid skin, often associated with genetics and aging, as well as the appearance of puffy under-eye bags. Other issues which can be addressed in the eye area include upper and lower eyelid hollowing, wrinkles, and dark circles, which may be addressed non-surgically. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. As an oculoplastic surgeon specializing in aesthetic procedures, I perform a wide range of cosmetic eyelid procedures. I also treat complications of eyelid surgery originally performed by other doctors. I have throughout my career developed several techniques in eyelid surgery to allow for minimal incisions, safer anesthesia, and quicker recovery. It's important to understand some basic principles. In a younger person, the skin quality, tissue volume, and bone structure gives the upper eyelids a youthful appearance. The supporting structures can change due to genetics, aging, and medical issues. The upper eyelid area can have fat pockets prolapse forward, hollowing, and excess skin referred to as dermatochalasis. Under-eye bags, which are caused by lower eyelid fat prolapse, is often associated with genetics and affects many young people. Under-eye bags are also often seen with facial aging. It's common to see both sagging skin in the upper eyelids as well as under-eye bags at the same time. Another issue affecting the upper eyelids, which is commonly associated with aging, is upper eyelid ptosis. Ptosis means that the upper eyelid position is lower than it should be, and this position is unrelated to the physical weight of the upper eyelid skin. Ptosis has to do with the muscle that raises the eyelid, called the levator muscle, like the word elevator without the letter E. The condition needs to be identified before any cosmetic procedure, so the muscle which lifts the eyelid is addressed at the time the surgery is performed to get the best outcome. For many people, the appearance of excess skin on the upper eyelids, puffiness in the upper eyelids, and hooded eyes can be very frustrating. Many of our patients note how it's difficult to apply makeup to the upper eyelids. Being perceived as older or lacking in energy is also a common complaint expressed by patients during consultation. In fact, the appearance of looking tired, even when well rested, is one of the most common reasons for inquiring about eyelid procedures. These conditions affecting both the upper and lower eyelids often occur concurrently, so wanting to have both upper and lower eyelids procedures done at the same time is a frequent request. There are specific procedures used to address hooded upper eyelids and puffy under eyes depending on the underlying causes and the degree of severity. For example, the appearance of hooded upper eyelids may be improved non-surgically, albeit temporarily, with a procedure called Botox brow lift, if the upper eyelid fullness is caused by eyebrow position only. If the eyebrow position has descended more significantly, well, surgical brow lifting options may be considered as well. If there is excess or sagging skin over the eyes, the more definitive and long-term solution is an upper eyelid blepharoplasty. An upper eyelid blepharoplasty is a procedure for restoring the upper eyelid's shape and contour, creating a more rested and refreshed appearance. Excess upper eyelid skin is carefully measured, a design is drawn to address the excess skin, and additional tissue below the skin is artistically contoured, so the eyes look refreshed and natural afterwards. Gentle handling of this delicate tissue with meticulous care allows for minimal bruising and swelling after surgery, resulting in quicker recovery. As far as under-eye bags are concerned, there are usually two approaches which are considered. These are the transcutaneous approach or the transconjunctival approach. The transcutaneous approach involves making an incision right below the eyelashes to get to the fat pockets. It typically leaves an external scar and an approach that can potentially lead to complications due to compromise of lower eyelid support structures. In addition, unnecessary skin removal can contribute to problems such as lower eyelid ectropion and lower eyelid retraction. For most of my patients, regardless of age and ethnicity, I prefer the transconjunctival approach. This procedure is considered technically more complex, but in my hands has proven to be safe with minimal risk of complications. Patients find this approach particularly advantageous as I'm able to maintain the natural shape of the eyes and avoid the rounded look which is seen all too commonly after eyelid surgery. Preserving the shape of the eyes allows me to provide my patients with a feeling of confidence about retaining their character while looking more refreshed. Specialized procedures for upper eyelid ptosis, or drooping upper eyelids due to a weakened levator muscle, can be performed at the same time when addressing the excess upper eyelid skin as well as under-eye bags. Specialized surgery like ptosis correction is done almost exclusively by oculoplastic or oculofacial plastic surgeons like myself. This is not usually done by general plastic surgeons or cosmetic surgeons. I routinely perform upper and lower eyelid surgery with any of the advanced or additional procedures necessary all at the same time. All procedures are performed using local anesthesia with light intravenous sedation, which means easier recovery and less downtime in comparison to eyelid surgery performed under general anesthesia. The upper eyelids heal extremely well, and the area where sutures are placed blends very well with the adjacent skin, even when the eyes are closed. Upper and lower eyelid surgery, when performed together, usually takes less than 2 hours to perform. Minimal bruising and swelling are typical after upper or lower eyelid surgery, and my patients routinely go back to work in 1 week. Upper and lower eyelid surgery can be performed at the same time with minimal risk and quick recovery. I recommend meeting with qualified and experienced oculofacial, plastic and reconstructive surgeons who specialize in cosmetic eyelid surgery so you can learn about your options. I hope you found this information helpful. Thank you for your question.